she said, hey, I want to have very natural breasts. I'm like, okay. We had the whole surgical plan. She comes the day of morning of surgery. Oh, I have this photo for an example. This is the complete opposite of, I think, what 99% of the world would call natural.
It is so incredibly difficult for anybody without the very specific genetic makeup to be able to reach that without our help. We're talking about what women or people in general are seeing in the media, and what people are seeing is goals of beauty, right? Change with times, of course, as people talk about different size women, different size men throughout time as things change. We went from Kim K, BBLs, very curvaceous, and now people are swapping more towards, people say ballerina body or yoga body, where people are, aiming for thinner in the time of GLP-1s. But it seems that no matter what the time and no matter what that swing, it is so incredibly difficult for anybody without the very specific genetic makeup to be able to reach that without our help, which is great for business, right? It drives people to well, I certainly can't do that on my own. So I need to see somebody to help out. But it makes it so incredibly difficult for us when they come in with a picture. They're like, hey, I want to look like this person. And you're like, not going to happen in a million years. It's there's no amount of money or time that's going to kind of get you there. And it's just because of their general anatomy, right? There's things that are possible and there's things that aren't possible, and it just makes our job very difficult. So it's good for business, bad for the patient. It's just, it's tough. And I'll be interested to see if they can strike, some sort of balance of different ideas of beauty during the fashion show.
Yeah, that's the hardest thing, I think, as a plastic surgeon. Like you said, they bring in people bring in photos, and it may not be anything like what their body habitus is, or like you said, their genetic makeup, right? And we can help them only so far. But it's helping set expectations with patients, because sometimes they are a little, I wouldn't say unrealistic, but they have to be kind of guided as to what's safe for them and what actually makes sense for their body. So I think it's really taking that photo and kind of taking the inspiration from that and kind of trying to paint them a picture of what's actually possible. And that, I think that's the hardest thing as a surgeon, at least for me, is trying to convey what I think I can achieve for them, and then they can see that, and then obviously them trying to convey to me what they're trying to achieve, despite it being a photo. I remember I had one patient, she came to me and she said, hey, I want to have very natural breasts. I'm like, okay. We had the whole surgical plan. She comes the day of morning of surgery, and she says, oh, I have this photo for an example. I'm like, oh, great. I look, and this is the complete opposite of, I think, what 99% of the world would call natural. I mean, this girl's got a USA bikini on, Team USA or whatever she was. I don't know. And they were just very, very rounded breasts. And maybe some women have that naturally. I've never seen that. But I said, okay, I'm like, whoa. And it made me realize that day, someone's interpretation of natural may not be the same as mine or anybody else's, right? But we have to respect that and then try to, again, figure out what their expectations are and try to match them safely.
Yeah, it's closing that gap between their expectations and what's happening on planet Earth. It's because if you can't get them there, they're not going to be happy. They'll be mad at you forever, right?
Yeah.
So what happened with that patient? Did you have to cancel her because you needed different size implants?
No, luckily
were you able to figure it out?
No, we have a consignment, so it took me a lot. It delayed the case because then I had to go make sure we had implants that matched the look she was going for. We have patients sign a surgical acceptance form, and I actually typically don't let them even change it. So if it's the day of surgery, they're trying to change things, I'd say we're not going to do that. So at their pre-op, we do all the consent. They sign it. They say, this is the plan. We sign it. Even the implant size, style, everything we have them sign, And so, but I had changed everything. It worked out. She was fine.
Yeah.
But I'm glad
That's terrifying.
I asked her and she showed me. Yeah.
Yeah, terrifying to have somebody change at the last second, because then you wonder, is that what she always meant? Mm-hmm. Or did you have a change of heart the last couple of days and then she's going to be desperately sad later? Yeah, I hate when somebody comes in and they're like, hey, so I was thinking, let's just do this today. I'm like, oof, hold the phone. Let's all take a second. Let's take a beat and let's make sure we've got a real good game plan settled. Because if I don't feel comfortable that you're settled, we're going to go ahead and cancel and come back and fight another day.
Totally. I've actually had patients show up the day of, and they were second guessing getting, let's say, a breast augmentation. I counseled them that day, saying, "Look, this is a decision that it is a permanent change to your body, even though the implants aren't permanent. The change to your body, to some degree, will be permanent, and so this is a huge decision for you. Like, let's push this." And so I had her come back at 3 weeks. I gave her some time to think about it. She came back, and we decided to just cancel it completely. So. For me, and I know you're the same way as surgeons, like we're never going to force surgery on anybody. Like I would never be, and she was like, well, I was afraid because I thought maybe I wouldn't, get my money back or whatever. She's worried about, I'm like, look, don't worry about that right now. We'll take care of you, but we're not going to do surgery. I'm not going to make you do surgery because you think you're going to lose money. Like that's the last thing we should ever do,
Yeah, so she'd just be unhappy. You
yeah.
End up having another surgery to get them removed, then her skin will be stretched out. She'll just be mad at you.
Yeah.
But I think for people outside of our profession, they do not understand how difficult it is to be at the cusp of starting surgery. Like your brain is already in the operating room. You're doing it. Like you're already like thinking about what you're going to do first and kind of making sure that you're on track. You've got that game plan going, like everything's heading away. And then a patient like brings up a question. And it's so easy to just be like, okay, whatever. Like this train's rolling. We're going to make it happen. But taking a beat, really listening to the patient, figuring out whether you need to like cut the ripcord and like just call it a day for that surgery and, miss out on not only surgical time, but all the planning that went into that. It's tough. And a part of you wants things to just go forward unchanged. And it's, being so focused on the patient to make sure that they're getting what they really need is the reason why you take that extra time and the, having a willingness to cancel cases. It's tough, especially when surgical time's hard to come by. I mean, for you, you all have your own place now, but for me, it's like I only have so much surgical time. So if somebody cancels at the last minute, you can't fill it. It's like devastating. Like I wanted somebody in that space.
Well, and if you have like a wait list, like a few years out, like that 6 hours you'll never get back. You can't fill it. There could have been hundreds of people that could have filled it, and they're waiting and it's fine. Like at the end of the day, it is what it is, right? Like again, we're not going to force someone to have surgery, but yeah, you're right. Like there's a whole like backside to this. And then it takes our staff, they have to rework and potentially move people or try and get people to fill it last second. There's just so many things. It's not just easy, but we would do it at the end of the day. It's like parenting's not easy either, but we do it because we want our kids to be successful and be happy, right?